Okay, again, hello everyone. Hope you remember me. I'm Dr. Prashant Kumar, working as Associate Professor in Department of Community Medicine, USIC Medical College, Gulbarga. So I have taken primary healthcare in India as first part I have taken. Now coming to with the second part. So again, I'll be dealing this with a recapping of whatever session I had taken earlier. What are the principles of primary healthcare and importance of primary healthcare, the challenges, and how to mitigate it or lessen the challenges. So again, coming to the previous thing, there were three levels of healthcare. You all know that is primary healthcare, secondary healthcare, and tertiary healthcare. Primary level, it is usually health and wellness centers, and secondary level, CHC, that is community health centers and the district hospitals. Tertiary care, medical colleges and research institutions. If you see here the term is primary health center, health center, sub center, and community health center. When district hospitals are named not named as district health centers. They are named as district hospitals. So basically, just to this, what is the difference between a health center and a hospital? Health center basically means a center, health center, or basically means a hospital which provides both preventive and curative services, or it is mainly involved in both preventive and curative services. Whereas hospital mainly deals with the curative services. So this the difference between health center and hospital is health center deals with the promotive and curative services. Whereas hospital mainly deals with the curative services. Right? This then how this primary healthcare started? First started with the comprehensive healthcare with the board committee, then the basic health services, both failed. Then the primary healthcare because of the it was mainly due to the mainly due to the community participation. Then elements of primary healthcare. Again, we have dealt this EL, EM, ENTS. I've dealt this in detail. Now coming to the topic proper of my today's class, that is principles of primary healthcare. Basically, if you see, there are four principles of primary healthcare: equitable distribution, community participation, intersectoral coordination, and appropriate technology. We'll be dealing with this in detail. Each one this is a very important topic. So first is equitable distribution. Before you should be knowing that what is equitable. There is a difference between equal distribution and equitable distribution. So you'll be knowing this by I'll be telling you what is the difference, but let us go through the slides first. The first principle is equity or equitable distribution. What is this? The health services must be shared equally by all people, irrespective of their ability to pay. That is either they are rich or poor, they are from the urban or rural area, and must have access to the health services. This is one of the basic principles. At present, if you see, the health services are mainly concentrated in the major towns and cities, resulting in inequality to the people in the rural areas and slums. Right? If you see, most of the, if you see, most of the even if you see most of the hospitals and health centers, most of the hospitals are situated in the urban area, and but if you see most of the people are residing in the rural area. That is what I'm told. So primary healthcare helps to readdress this imbalance by shifting the center of gravity from the health from the cities to the rural area. Actually, it was where the most number of the people live. Now coming to what is equitable distribution. Equitable distribution is providing resources to the people according to their need. Again, if you see this example, I think you'll be coming to near. So this is equal distribution where the boxes are equally distributed to each and everyone. Whereas this is equitable distribution. Equitable distribution is providing or allocating the resources to everyone, but according to their need. Now, if you see, the resources are allocated only to the urban areas where like hospitals and all are situated, but maximum people are staying in the rural area where resources are not there. So if you see, this is equality and this is equity. Hope you'll remember this for your lifetime. What is the difference between equality and equity? And our primary health center focuses on equitable distribution, not equal distribution. That is, whichever our resources required are more, the resources has to be transported there. Okay, so this is equitable distribution. Then community participation. Primary health care cannot be achieved without the involvement of the local community. Again, if you take example, when local community are involved, or when I am involved in something, which with when a decision is made, yes, I accept it because I am involved in it. It is my decision. Like that, this here also the community should be involved in planning, implementation, and maintenance of health services. This has maximum reliance on the local resources. Like local resources should be there, and the local people should be involved. They how they are, how they are selected, or they are selected from the local community and trained locally in the delivery of primary health to the community they belong. Now, excellent example is ASHA workers, right? ASHA workers, they're selected from the local community where they're supposed to serve. Even Anganwadi, same thing. So they are selected from the local community. They are trained in some issues, some things and all in the primary health center or CHC, wherever it is required. And they are made to work in the same locality where they come from. By overcoming the cultural and communication barrier, they provide primary health care in the ways that is acceptable to the community. Hence, they form an essential feature of the primary health care in India. Then coming to the intersectoral coordination, components of healthcare cannot be provided by the health sector alone. Health cannot be provided by the health sector alone. There are various other sectors which play an important role in providing the health. The declaration of Alma Ata also states that primary healthcare involves the addition of health sector, all the other sectors, right? So, like, what are the other sectors? Usually involve water and sanitation, agriculture, animal husbandry, food industry, education industry, housing, public works, engineering, women and child development, labor, everything. Again, I'll give you an example, you'll hope you'll understand it better. So MR campaign was started where each and every child belonging to 9 months to 15 years was immunized with the measles and rubella vaccine. So that is called as MR campaign. So what did government do is government involved different sectors. Which are the sectors involved? The health sectors, of course, we were involved because we are supposed to immunize the child. Then came the DDPA and BEO, that is from the education department. Why that were involved? Because if you see, these the children belonging to these years are maximum are found in the school. So once we get the list of students available in the school, which school has how many children, how or which age group children are there, how many children, we can plan according. Okay, this is the school in which more number of children are there. We need to put more number of health resources person there from morning to evening and immunize all the child. Okay, this is a play school where hardly only 50 students, when hardly 50 students are there, one health worker is enough and she can finish it in a 2 or 3 hours, like that. DDP and ICDS, because children less than 6 years, Anganwadi will be knowing, and also the dropout children or school children who are not going to school, the Anganwadi will be having a detail of them. That way they were involved. IMA, Indian Medical Association, was involved. It is a part of health sector. They were involved. Indian Association of Pediatrics, that is IAP, they were involved because adverse effect following immunization, anaphylaxis, they have to deal. So they were involved in it and they gave cooperation. Media, why this MR vaccine is giving, when it will be given, and all. And local leaders and politicians, because many people follow them and they treat. And if they in many places, if you say they tell, then every people will follow them. So these people were all involved, and collectively when they were involved, this program became a massive hit and we were able to immunize almost every children with MR vaccine. This is called as intersectoral coordination. But one thing when it comes to intersectoral coordination is planning refers to our duplication of work. Otherwise, we as a health sector will be doing the same thing, collecting the data of the people. BO will be collecting the data of the same students, and again ICDS or Anganwadi will be doing Anganwadi will be doing the same data by collecting the people. So in collect, so the main thing is call the respective representative from the each department and plan such that your work is smartly done and you do not duplicate the work. Then using the appropriate technology, again various is what basically is technology. Technology that is scientific, appropriate technology that is scientifically sound, adaptable to local needs and acceptable to those who apply it and those for whom it is used, and that can be maintained by people themselves in keeping with the principle of self-reliance with the resources of the community and country can afford. So it is scientifically sound and adaptable to local needs and can be used by a simple man, no need of a recognized person for it or a hi-fi instrument for it. So that is appropriate technology. It should be cheaper so that even the developing countries can afford it, and it should be simpler because you do not need a qualified person every time. Again, because qualified person will not be available every time in the PHC or sub center. Every time he or she may or may not be available. So if it is simpler, even paramedics can be using it. So what are the examples of this? The ORS, the one of the best example is ORS. So instead of IV replacement, that IV replacement and all, simple ORS in mild and moderate diarrhea can do wonders. Then the growth charts, the trend of the growth of the child, by seeing that we can immediately diagnose the child whether his growth is normal or he is having a stunted growth or even his growth is decreased, and he had to be referred to the pediatrician immediately. That is it. VVM, one of the excellent thing, VVM, that is vaccine vial monitor. By just seeing the vial of this, we can tell whether the vaccine is potent or no. Instead of sending again in so we will, otherwise if VVM did not exist, we would have sent one vaccine from each lot to the lab to check whether the vaccine is potent or no, and we should have the time for that vaccine to go there, tested, and the result to come back, and the money involved in testing, that we are saving all this. So this is one of the best example for appropriate technology. Then mother's card, by seeing mother's card, what was her history of previous pregnancy, her now height, weight, everything, by knowing whether she is, by knowing all this, we can tell whether she is in high risk pregnancy or not, and also we can plan for the family planning to her. So basically, these are the four principles of primary healthcare. What is that? That is equitable distribution, intersectoral coordination, community participation, and appropriate technology. Very frequently asked 5 mark question for the UG students. So these are the things. Then why is PHC or primary healthcare really important? Because it focuses on health for all. That is one of the commitment we have given to the WHO, and it focuses on quality health services and cost effectiveness, because we have seen the health using of appropriate technology. Then primary healthcare integrates preventive, promotive, curative, rehabilitative, and palliative services. That is, again, it gives the comprehensive healthcare which Sir Joseph Bohr had started. Yes, comprehensive healthcare. Then primary healthcare encourages community participation through the involvement of ASHA workers and Anganwadi workers. It promotes equity. We have seen what is the meaning of equity. Then primary healthcare advocates on health promotion and focuses on prevention, screening, and early intervention of health disparities. Now, if you see the non-communicable disease program, the program for NCD, screening is one of the important thing in that. Then the primary healthcare is also perceived as an integral part of country's socio-economic development, because when primary healthcare is good or sound, people tend to be healthy, people are more healthy, the production increases, the production increases, the economy of the country increases. So challenges for implementation. What are the challenges that we face? Most thing is poor staffing and shortage of health personnel, especially in rural area. Even if it is in the rural area, if we ask anybody like where do you work, where do you wish to work, everyone will say we are ready to work in the urban area. Rural area, it is quite tough. So that is one of the major issue. Then inadequate technology and equipment, poor condition of the infrastructure, especially in the rural areas. Then concentrated focus on curative services rather than preventive and promotive health services. That because primary health care is comprehensive health care, which involves preventive and preventive, but more focus is given on curative services rather than the preventive and promotive services. Then poor quality of the health services which are being provided, lack of financial support many times by the government, lack of community participation, challenging geographic distribution, because health center is distributed here, the village under which it comes is here. Either there may be no accessibility, and many times accessibility is a major issue. That is again a problem. Then lack of intersectoral coordination, because people belonging to different sectors, they have their own bosses and all. That is again sometimes a problem. Meeting and planning and all is sometimes a problem, practical problem. So how to reduce it or the mitigation measures that can be planned. So encouraging community participation to rapport building, effective communication, and sharing objectives and benefits of primary health care. So you build a good rapport, you explain them why are they important, and how the community will be helped out by this. So yes, then the community participation will be there. Developing quality assurance mechanisms like VVM, then allocating resources as per the need. Which area requires more funds, that area should be given priority. That is again equitable distribution. Then develop a planning process to define objectives and set targets by giving priority to those families and communities at more risk. Whichever are at grave need, address that first. So again, these are my references. So primary health care covers the majority of the person needs, that is promotion, prevention, treatment, rehabilitation, palliative from birth to the final day of this. So it covers the majority. I've shown here it covers the majority, not everything. It covers primary health care provides majority of the health needs. So primary health care is important. So this finishes my topic. Thank you. Again, I thank the IAPSM and UGeConnect team of the IAPSM. Thank you once again.